Good morning, everyone.
Hi, good morning.
Good morning, Dr. Williams.
Good morning.
Welcome, everyone. We'll give folks a few minutes to join, and then we'll get started with a very busy agenda.
Hey, good morning.
Good morning, Melissa.
How are you?
Good. How are you?
Good. Computer audio is working by itself.
Thursday win.
Right. I got my headphones at the ready just in case.
Well, while folks are joining, good morning, everyone. My name is Heidi McPherson, co-lead of the Health Equity Collective. We'll get started in just a few moments. I see lots of folks coming in. In the meantime, if you would please introduce yourself in the chat and include a few details about yourself, we much appreciate it. And we'll get started with the content here just shortly.
And most expensive expedition companies on Everest. People come here to Everest and time.
Let's see. Well, we're only at 2 minutes after. Thank you for the introductions in the chat, everyone.
I'll put my earphones in a moment.
For those of you who are just joining, if you can double check to mute yourselves, we're going to go ahead and get started now. Welcome everyone. If you're just joining us, please do introduce yourself in the chat with your name, organization. Let us know if this is your first meeting. I know there's quite a number of new folks. We've had a big uptick in people joining our Mighty Networks platform in the past week. And also share what brought you to the Health Equity Collective. We'd love to know. And then if there are any new resources around health equity or components of it, we'd welcome those in the chat as well. And with that, let's get started. We've already started the welcome and introductions. We're going to talk about some of the highlights and recent wins to start out. And then we'll have Dr. Boerwinkle lead us off with some of the anchoring of this work moving forward, some exciting evolutions in this work. Then we'll talk more about our growing focus on the living conditions and then have updates from each of the work groups. We'll close with community announcements. Shrila, do you have anything to add?
No.
Okay. So with a celebrating of recent wins, we're now over 180 organizations. This is lots of individuals. You can see the number of folks who have joined our online networking session. An uptick of 71 just in May. And then on LinkedIn, 105 folks have joined again since May. If you haven't joined those sites, we do welcome you to do so. And then we're excited about some of the national recognition that our work is getting. Dr. Jemima John shared some of the work that's happening out of the Food Security Work Group in the ISBN, which is an international conference. And really was able to highlight our progress and collaboration there. And then upcoming, Kalal Mohata with PCIC, who's taking the lead in building out the community information exchanges resource directory exchange. So linking resource directory sources is going to be presenting that work in August at the National CVTAS Conference.
Health equity.
I'll be on a panel alongside several other leaders of similar social determinants of health efforts around the state of Texas in that same conference. So exciting to have folks recognizing the work that we're doing here in Houston. And there's lots that's happening in the work group. We'll leave some of those details to the work group updates, but did want to highlight some of the engagement around our monthly networking sessions. For those of you who are new, those networking sessions are thematic and really are intended to be learning opportunities, but then informal engagement conversations. And you can see some of the recent topics on minority health, women and maternal health. We had a special session on gun violence prevention after the events in Uvalde, and then had a session later in June on food security and the evidence supporting food prescription programs. Really strong engagement on these. And I think part of what's exciting about these conversations is it brings people together who are working in these respective spaces, connects them, and then these have been moving along. You'll learn more about the Health and Housing Collaborative in just a little bit, and some of the work that we've been collaborating with the maternal health collective impact effort all along. It really supports and builds the different efforts in different components of health equity promotion. If you have a topic, we welcome you to email that to Wes Gibson, who's with the Houston Food Bank and is leading the organization of those networking sessions. He'll share more about what's coming up later on in the agenda. And then we want to recognize, our work groups have been active for a bit over 2 years, and we've got some changes in leadership, some passing of the baton.
It's Morning Edition from NPR News. I'm Rachel Martin in Washington, D.C.
I'm May Martinez in Culver City.
Let's mute a few NPR stations. And so we want to recognize some of the leaders who have been a part of moving this collaboration forward. And we've got some who are shifting roles within the collective, and then we've got some who have moved on from their organizations, or in some cases moved on from Houston and are not currently active in the collective. So this group here, Dr. Siraj with Harris Health, Michael Walsh with MD Anderson, Ruth Reckes with MD Anderson, Nancy Correa with Texas Children's, and Nadia Siddiqui, formerly with Texas Health Institute, all contributed significantly, and I'll talk a little bit more details in just a moment, to the work and where we are today within the Health Equity Collective. They're all kind of changing seats on the bus, still very much active within the collective, but their roles as co-chairs within the various work groups, they're moving on from those roles. And some of the actual work groups are moving on and evolving into the living conditions as well. So we just want to recognize and thank them for their service. And then this group of leaders is it has moved on. They've switched positions or left our region entirely. Tim Schauer, who was formerly with Cornerstone, Stacy Lofton, who was our backbone lead at Harris County Public Health, Eric Bakota, also with Harris County Public Health, and Alejandra Posada with Mental Health America, as well as Veronica Reyes, who was formerly with Blue Cross Blue Shield of Texas. So we thank them also for all that they contributed to this work.
Same areas.
And here's a little bit about what they did. Stacy and Tim were the co-chairs of the policy work group and really built out a comprehensive food security policy mapping of opportunities and shared and promoted that across the collective, and then built out conversations and connections around other social determinants of health policy in an ongoing way. And then from the data sharing ecosystem work group, both Siraj and Eric Bakota were the co-chairs of that work group and really helped spearhead the development of the governance and resource directory exchange. Lots of progress in that work. You'll be hearing more about that a little bit later in the agenda. And Ruth and Nancy co-chaired the Coalition's Alignment Work Group, which did a robust scan of the coalitions in operation around health and health equity in our region, as well as the foundations. That set the foundation, for the living conditions collaborations. That's really the growing focus of our work. Again, more to come on that. And then Alejandra Posada was one of the founding co-chairs of the Mental Health and Substance Use Work Group. She helped launch that and set some of the priorities for the work that is underway within that work group. Nadia and Michael spearheaded the development of our framework, and the framework really does anchor the future direction of where this collective effort is going, as well as how we build out living conditions collaborations. It's really been foundational for our work, and we thank the about 40 other leaders across the region who were a part of that process as well. And then Veronica Reyes co-chaired the Community Voice Work Group and helped build out our matrix of strategies there that's under development. So lots of gratitude to them for what they've contributed to this work and the foundation of how we build forward. And moving forward, we are welcoming a handful of new co-chairs, Dr. Stanley Williams with the Harris Center, William Lyons with Legacy Community Clinics, Wes Gibson with the Houston Food Bank, and Jordan Everett with CCPPI. You'll hear more about the work that they're leading in their respective work groups. And moving us along, I'm going to pass it to Shrila to talk a little bit about anchoring this work moving forward.
Thanks, Heidi, and good morning, everyone. You can hear me okay, right?
Yes.
Good morning, everyone. I'm Shrila Sharma. I'm with UT Health School of Public Health and one of the co-leads of the collective alongside Heidi. And we wanted to share a little bit about anchoring the work of the collective moving forward, specifically as UT Health takes the role of the sole backbone for the work of the collective. Do you mind moving to the next slide, Heidi? So just to level set in regards to the role of backbone organizations in regards to collective impact, these are the functions of the backbone organizations as it pertains to any collective impact work. These are the best practices as guided by FSG. And specifically, that's the role that the three organizations, the American Heart Association, Harris County Public Health, and UT Health have been playing for the last over 2 years and setting the guiding vision and strategy, supporting aligned activities of the collective, establishing shared practices, cultivating community engagement and shared ownership, advancing policy and mobilizing resources. And on the right-hand side, you can see sort of the schematic, which, and that's largely the structure that we've been following with the collective. The backbone organization plays the role of the backbone in guiding and facilitating the work of the collective. And as the work of any collective impact framework, there's a starting point and then an evolution that the collective usually goes through, which we have over the last couple of years, and with a lot of exciting work underway, as many of you have co-created these strategies together and are leading them for our region. So we wanted to just level set today and spend a few minutes talking about the role of the backbone organization and how that has particularly evolved and where we are today and where we want to go tomorrow. So with that, I'll hand it over to Dr. Boerwinkle, who's the Dean of UT Health School of Public Health. Eric.
Thanks, Shrila. So as was already mentioned, but I'll introduce myself. My name is Eric Boerwinkle. I have the honor of serving as the Dean of the UT Health School of Public Health. And, as Shrila already hinted, that since the early days of the collective, actually, and it's been more like, more than 3 years now, that the backbone organization and the leadership role has been shared, I would say wisely, among 3 groups. First, Harris County Public Health, the American Heart Association, and the UT Health, primarily represented by the School of Public Health. And really during those early years, our primary goal, for lack of a better word, I'm going to lump it all together under the umbrella of planning, a lot of planning and governance. And I think therefore it was better to have a larger, broader, and more diverse backbone structure. But as we phase, I would say, from planning into implementation, it's important for us to be nimble, more nimble. I also think it's important for us not to lose those fundamental premises of the collective impact organization and the backbone organization, or the backbone responsibilities that were on the previous slide. And one of the reasons that I've been brought on is to be able to very firmly state the support of UT Health for the Health Equity Collective at the very highest levels, and our commitment to serve as the backbone organization, again, under the rubrics of the collective impact format. So we are planning on continuing in that role. I want to be very clear, and I'll say more about it in the next slide. Without the hard work and cooperation of the American Heart Association and Harris County Public Health as a backbone organization previously, we frankly just would not have been able to get to where we're at today. So it's only because of their commitment and hard work we're able to make this transition. And again, I'll say more about that in a minute. For those of you who are wondering, I can reassure you that the AHA and Harris County Public Health, they remain committed to the collective. They remain committed to the ideals of the collective, and they'll remain important parts of this group and the various working groups going forward. So you will still see a lot of the people you're used to seeing, and plus new people. It's just a reorganization really of the backbone structure of the organization. Next slide, please. So this is just, sort of my way or our way of thanking the American Heart Association and Harris County Public Health for their many, many contributions. I mean, we could go on and on for a long time of everything that they've done. This slide just simply calls out a few things that I'll mention. I'm not going to read to you. I would say the first line is contributing expertise, and I'll stop there. Both the American Heart Association and Harris County Public Health have been extremely generous in contributing their expertise really to the collective, and making sure the collective really had good foundations in the collective impact approaches, reading off that first line. Support in the launch of the collective's branding process was another important part. The American Heart Association brought to the table a lot of experience in marketing and branding. And again, the collective was able to benefit from that wisdom and experience. And then again, both of these groups participated in a lot of working groups. You'll see those initials, AHA and Harris County Public Health, over and over again across the various working groups. But there is a shout out here for AHA and their commitment to the social determinants of health policy, food security, and communications working group. So again, I personally thank the leadership of American Heart Association for their commitment to the collective and their continued commitment to the collective. Harris County Public Health, it's hard for me to I have a close working relationship with Harris County Public Health, so it's hard for me to begin thinking about how to thank them, but basically their expertise again, particularly in alignment of the Healthy Living Manners and other county health initiatives. And that work continues, by the way, particularly under new leadership at Harris County Public Health or new initiatives. And there are a lot of discussions happening both in the fore and the background to make sure the work of the collective and Harris County Public Health can continue to be closely aligned. Individuals at Harris County Public Health have co-led a variety of working groups, including social determinants of health and policy and the data sharing ecosystem. I think Eric Bakoda was thanked on a previous slide. And then finally, and extremely important, and this again goes to both organizations, basically bringing their expertise and their knowledge to health equity, the concept of health equity, and again, how to implement a program under the collective impact format to begin to move the dial and move closer to health equity. Next slide, Heidi, please. So just a little bit of an update moving forward. Again, as Dean and representing the President's office also, UT Health will continue to serve at your pleasure, by the way, to serve as the backbone organization with a focus on facilitating collaboration. We will continue to be not only supporters, but I would even use the word zealots for the collective impact format. We'll also continue to beat the drum to make sure we're bringing evidence-based health equity efforts of all sorts and make sure they're data-driven and evidence-based. The priorities for 2022, which I will remind you tomorrow is July 2022. So we're halfway through. We do need to update the collective's governance documents, moving from 3 to 1 backbone organization, and clarify the role of the steering committee and actually other committee formats and leadership roles. One of the things that I have committed to working with Shrila and other leaders in the collective is making sure we can establish a sustainability plan for the collective. If we just put together plans and a couple of programs, and then for whatever reason, people move on to the next great hot topic, we will have failed the people that we are here to serve. So it's important that the collective really has a long-term vision for achieving equity. And I am committed to helping work with that sustainability plan. And then finally, there'll be a lot of discussions, and I enjoy these meetings and others around the collective. I learn a lot, and thinking about how we can better integrate and better anchor the collective within UT Health's organizational priorities. We have a lot to learn from you, and I hope we have quite a bit to contribute to the collective. So with that, and in summary, I remain committed both to the collective and remain committed to serving as a backbone organization. So Heidi, if you don't mind, I'll turn it back to you.
Thank you, Dr. Boerwinkle. Much appreciated.
Can I just also interject for a second and just say thank you to Dr. Boerwinkle and the UT Health leadership for their invaluable support. I also want to thank Dr. Bob Morrow, who both Eric and Bob have been extremely generous with their time and their support and their mentoring and lots of advice over the last 3 years to move this work forward. The mission of the collective and is a core public health mission and aligns well with that of the School of Public Health. And so we are very, very grateful to both Dr. Boerwinkle and Dr. Morrow for their invaluable support over the years.
Yeah, thank you.
Thank you, Shrila.
Well, thank you. each of us, each of you are what makes this work possible. So thank you. Let's move forward. And we're going to talk about some of the next steps, some of the areas of focus. As Dr. Burwinkle just shared, we're going to be revisiting some of the governance and formalizing some of the governance as far as membership and roles for the different work groups and entities of the collective. Michael Walsh for MD Anderson is going to serve as chair of this task force. We'll be looking at building out a membership agreement and also some structure for the living conditions work group. You can see some of that work is already underway, but lots more to come on this later in the summer and in our next quarterly meeting. So our work groups have shifted and evolved, and we shared with you in our last meeting kind of the direction of moving towards more of the living conditions. And for those of you who are new to the collective, this is our framework. We'll have it a little bit bigger here shortly. But the framework here, these living conditions are where so much of the work and opportunity for collaboration across organizations and sectors lie. And so as we move forward, we'll be moving towards building out capacity in those in those living conditions spaces. We started this with food security, also the mental health under the whole person care work group is well underway, and we've got some new additions and conversations coming along as well. And then we have more of the actions for health or the levers for change. And a lot of this is looking at the systems and shifting systems. And that's where the community voice engagement work group, our communications, which is a key part of engagement across all stakeholders, as well as policy support of the different living conditions will continue. Our community information exchange and data sharing ecosystem work continues as a task force. We're excited for new work that's about to kick off with the community health workers and human capacity for care coordination to address social determinants of health and improve health equity. And then the governance, which I just spoke about. All of these work groups and task forces have live timelines for the year, so you can access them by the link that's going to be in the chat here just shortly. But we want to maintain transparency about what are the specifics that are happening in each of these groups. And we welcome you to join those efforts and roll up your sleeves alongside us and move the work forward. And so here's the framework. And I want to pause and reflect on this as we build out the actions for health here, anchored by community engagement, and to shift these drivers for health and the focus here within the living conditions. As you all know, so much work is already happening in each of these spaces across the community. The work of the collective is to link that together. How do we make it stronger together? Our motto is driving better health together. How do we put that to action? That's where the living conditions work groups and the structure is developing. And so next I'm going to share with you some of the feedback that about 87 of you responded in surveys to the different living conditions and different priorities within your organizations and the work that you do. And that has informed these draft structures for the living conditions, really looking at what is the process by which we come together. I'm not going to go through all of this, but just wanted to share with you at a high level some of the initial thinking and thank the steering committee for their contributions to this, as well as some of the work group conversations. And that looks at these different roles then within the living conditions. And each of them is important. They hold an important piece of the puzzle of how do we have that transformational impact. So the actual survey results, we had 87 members of the collective respond, and 27 did so anonymously, wasn't required to disclose who you were. But you can see the 53 organizations that were represented within those who disclosed which organization they were with. So very robust, very multi-sector, lots of interests represented within the responses to the survey. And this was a complicated survey. It really looked at, you'll see the questions here. There are things that many folks would have had to go ask a number of other leaders within their organizations in order to respond. So the fact that we had 30% essentially of the organizations responding to this survey, I think is really a testament to the commitment to this work and building it out moving forward. And so living conditions, when we look at who's focused on which living conditions, you can see some of those that are highlighted. People could pick as many as they wanted. Not surprising, we had very high responses in the access to healthy foods and food security. We had a lot of the food security stakeholders in our collective. So those came in at the top. And then next, tied were housing and education. And you can see the rest of the results there. I'm not going to go into that. I would also say the whole person care was high. I'm hearing some music. Where are we hearing music from? If you could please mute yourself. In the meantime,
yeah, I'll try and mute. Oh, there.
Okay, thank you. Okay, so those were the highlights. I will also say that whole person care also had high responses, and in the comments here, a lot of the comments were related to mental health specifically. Whole person care is really wrapped into the or encompasses mental health and substance use and just the holistic care. So I think folks didn't necessarily recognize that mental health was in there in all their choices. And then when we look at the actions for health, and so that's the top part of the top half of the framework, you can see where organizations were focusing. And again, many organizations are doing work in more than one or sometimes all of these sectors. I think one of the things that we knew on one end, but not necessarily numbers, was that we have a lot of funders within the collective's membership. And so you can see of the responding members, 32 were funding health equity efforts. And then more focus on the actual interventions. So again, that aligns with the growth around living conditions collaboration. So care coordination and the actual interventions, again, were tied with a little bit lower in the policy and research and evaluation and learning, both of which anchor health equity and health equity promotion. When we look at the health behaviors and who's focused on which of those, again, a nice spread with physical activity and nutrition being at the top, but healthy relationships and substance use also well represented. And then when we look at health outcomes, and you'll recall that the framework intentionally incorporates very broad terminology. We wanted all organizations to see themselves in the framework and where their work fit in. So we have a variety. I mean, I think all of these outcomes are well represented. I will also say on this particular question, there are many different comments with specifics, which we can use as we further analyze the results and build out some of the focus areas within the living condition work groups. And with that, we're going to move to an example in an exciting growing collaboration within the membership. We have Alan Watkins, who's with the Houston Housing Collaborative. And he came to us alongside Dan Potter with the Kinder Institute and really wanted to talk about health and housing and how to link our respective coalitions' efforts to drill down on health and housing. And I'm going to let him take it away. Alan, you're up.
Good morning, Heidi.
Good morning.
And good morning to all the members and guests of the Health Equity Collective this morning. I'm truly excited to be here. I look forward to these quarterly meetings as they are very informative as to what's going on in the health space, and so these meetings are really valuable to get better insight there. And so, as Heidi mentioned, my name is Alan Watkins. I am the executive director for the Houston Housing Collaborative. The collaborative is an organization that's been around since 2016, called together by a lot of nonprofits and volunteers interested in pushing advocacy work in the housing space. And so since 2016, volunteers have been doing that work. And so I came on board as executive director for the collaborative in February of 2021. And so it's good to be here, and I really enjoy the work that we do and this potential partnership that is brewing between Health Equity Collective and the collaborative. And so today I want to talk about, I just want to share with you more about what's happening with the Houston Housing Collaborative, because it will segue and tie into this linkage between housing and health, social determinants of health that Heidi identified, that Heidi just went over in the survey. We want to do more work that will identify very different topics, more specific topics that are related to housing and health. Do more research, and then not just research for research's sake, but also to advocate after the research is done. And so, next slide, Heidi. And just to kind of orient you around where the collaborative fits in the housing space here in Houston. So we put together this infographic that hopefully summarizes that just a bit. And so the green circle, as you see, is the housing collective, is the housing collaborative, and the blue is housing advocates. And housing advocates are basically just any person, any member, any organization that has a passion for moving policy work forward here in the Houston area. And so the housing advocates inform what the issues are and what the topics are they would like to consider. And so collectively, both housing advocates in the blue and the collaborative in the green, together, we inform and influence and encourage policymakers to change policy that will ultimately spit out, if you will, good quality housing for all. And so that's the space where the collaborative fits within the Houston region. Next slide, Heidi. And so the mission of the collaborative is a community stakeholders organization who collaborate to support policies, production, and preservation of quality housing that is affordable for and accessible to all in the Houston area. Our vision is a Houston where everyone has access to safe, quality homes that they can afford. Really important that they can afford. We all understand housing prices are going up, and so that three-word phrase, what they can afford, is really, really important. And so our purpose statement is a collaborative that the collaborative promotes equitable community development policy and works to expand affordable housing opportunities for all of Houston. The aim of the collaborative is development, adoption, and implementation of a cohesive and equitable, comprehensive housing policy framework with the broader community. Our three core activities that are on the next slide are centered around this: knowledge sharing, which happens at our monthly meetings every month, advocacy work, as mentioned, and then community basis, and then community engagement. It's very important, just like the collective, the Health Equity Collective. It's very important that our members and that individuals and stakeholders are involved and help to push and are engaged to push this work forward. Without our members, without volunteers to help support this work, none of this would be possible. Next slide, Heidi. One of the things that really makes the collective valuable, in a sense, is that we lead by our values. We try to wear our values on our sleeve, meaning that diversity, we try to be inclusive, dignity, equity focused, knowledge sharing, advocacy. These are values that we try to wear on our sleeve and try to implement every single meeting that we do, whether it be a work group meeting, a monthly meeting, a coordinating team meeting, and then additional values: transparency, consensus driven, and action oriented. Are additional values that we try to implement each and every time we gather as a body. The next slide, Heidi, really supports, really gives you an idea about how the collaborative works. And so at the core is the coordinating team that essentially serves as a board of directors for the organization. Right now, we are fiscally sponsored by an organization called the Texas Association of CDCs, which is out of Austin. They do great state work in the housing space, and so we don't call ourselves a board of directors, but we do have a coordinating team which serves in that function. And then standing committees like the financials and the nominating committee, so forth and so on. Those are the standing committees that report to the coordinating team. But then the work groups are really made up of members from the membership body. So the membership is really the basis of the organization. And again, they make up some of the work groups that we have. And work groups can be examples of advocacy work groups. So for instance, right now, we're focused on minimal affordability periods that the city is promoting around 3 new subdivisions that will be coming online in the next couple of years or so. And so we're trying to get in at the early stages and help to see if we can kind of steer that affordability period to make it even longer, 15 years, if not longer. And the longer aspect is a partnership with the Community Land Trust that we are also promoting as a way for the city to promote and to lengthen the affordability period for those subdivisions. And so that, in a sense, is the organization, and it aligns with the Health Equity Collective and all the things that Dr. Boerwinkle and others have talked about earlier about the Health Equity Collective. The mission and the structure of the collaborative is similar to the mission and structure of the Health Equity Collective. And so it made sense for us to get together and to partner and to do this work of housing and health together. And so that's what we're exploring. So the next slide really, just really quickly, just gives you an idea about when our meetings are. Next slide, Heidi. And so if you are interested in attending a Houston Housing Collaborative meeting, our next meeting will be next week, next Thursday, July 7th. All of our general meetings are from 9:30 to 11, and you can see other dates there for the monthly general meetings. And then the last slide, Heidi, that I'll give is just our handle for our website and for our social media pages there. I bet you can't guess what our handle is because it's all the same. And so please, if you will, follow us on any of those platforms. We would love to have your presence, your engagement in those platforms. If you'd like to learn more about the collaborative, visit our website, sign up for our mailing list, and so forth and so on, and we'll be happy to get you engaged. But the focus of this, presentation is really about the linkages that we can do, that we have between the Houston Housing Collaborative, along with the Health Equity Collective, and all of that is centered around the linkages between housing and health, and that's what we want to explore. And so I want to turn it over to Dr. Dan Potter of the Kinder Institute, who will go more into what that looks like and how you can be engaged. Go ahead, Dr. Potter.
Great, thank you, Alan, and thank you, Heidi, for the opportunity to share out with this group here this morning. So, Alan, that was a great tee up in terms of what HHC is doing, and so the Kinder Institute. I don't have a similar accompanying slides to sort of introduce who we are, and I think perhaps in retrospect I might have thrown a couple in there because the Kinder Institute is going through a little bit of a transition and change period right now, as perhaps some of you may know, but in case others aren't familiar, the Kinder Institute for Urban Research is at Rice University. It has been led by Bill Fulton for the last several years, and he is now moving on, and Ruth Lopez Turley is moving in as the new director. Dr. Turley has been the director of the Houston Education Research Consortium. That's a mouthful, so we refer to it as HERC, which is part of the Kinder Institute for the last decade. And she is stepping in as the new director. And one of the things that she's doing in this new director position is embracing this idea of partnership models, of partnership work. And so that is where I am joining Dr. Turley in this push for developing some new partnership research models throughout the Houston area to build on the work that we've been doing at the Kinder Institute and some of the way we've been doing work at HERC. And so connected, I've had the opportunity to connect with Alan Watkins. I've had the opportunity to connect with Heidi McPherson here with both HHC and HEC. And through these connections and conversations, what started to arise was an opportunity for us to think about this intersection of stuff. We can't really talk about housing without health, can't really talk about health without housing. And so wanted to connect today with you all to share out a little bit about when you might hear me talking about partnership research, when you're hearing about this work we're looking to partner together on, what are we talking about? And so really when you're hearing us talk about partnership, what we are trying to get at is a vision for doing research for working together that is starting out with valuing diversity and expertise. And what that means is that we, the Kinder Institute, are not here trying to pretend that we are experts in the space of, we are certainly not experts in the space of community health. This is a very new territory for us to be getting into, but that we embrace this diversity and expertise, knowing that we at the Kinder Institute do have some expertise in data and research, and that those expertise can be leveraged alongside of, in collaboration with, the expertise that are owned, that are practiced by you all here in HHC, in HEC, and with the HHC. In addition to valuing the diversity and expertise, we look at partnerships as stuff that are long-term. We're not here to talk about a project that we're interested in doing, but rather, how do we sit intentionally with this question about the intersection of housing and health for years, quite frankly. Working in that space collaboratively together, finding mutualistic benefits. And at the end of the day, our goal is to improve and transform. We are solutions driven. Research for the sake of research is wasted research. And so, how can we make sure that anything that we're about to tackle, any projects that we may take on, have an end use goal in mind? Next slide, Heidi. And so when we talk about this partnership research, we will oftentimes at the Kinder Institute throw around phrases like research practice partnership, RPP. I believe that there are very, very similar models that may have different words or different terminology used within the community health space. I will ask that rather than get hung up in the semantics, that we embrace the spirit of what is trying to be described. And so I'm laying out the spirit of RPPs, knowing that this spirit transcends various different models that may be practiced. So again, it works with this idea of starting from this premise of a diverse form of expertise, utilizing, embracing that, coming together with those different forms of expertise, setting out on this idea of something long-term. Again, this is not about a project. This is about working together, long-term collaboration in mind. Through that long-term collaboration, this sort of iterative process of finding, developing joint work, using that joint work to find solutions, using those solutions to drive the next piece of joint work. And so that sort of third step we can just iterate through for quite a while. And part of that just has to do with there's a lot to do in this space, but that through that iteration, eventually arriving at this space where we see improvement, we see transformation, where we're addressing systems, sort of owning the fact that a lot of the solutions that people oftentimes throw around are band-aids. They're not actually addressing the root causes. They're saying, oh, we've got hungry people. Well, give them food. Well, why were they hungry in the first place? As a very basic example of when we're talking about root cause is what we're trying to get at there. Next slide, Heidi. And so we are reaching out to this group today to share this idea of how might we be bringing HHC, HEC, the Kinder Institute together to work on this intersection of housing and health. And just an idea about what this could look like. Some of the, again, I think I've shared ideas, but what do those ideas look like in practice? This would be about coming together to co-design a research agenda. Once that agenda is put into place, figuring out what different roles people can have, whether that be collecting data, disseminating data. For sure, once data starts to be analyzed, working to understand data together. Again, this is that moment where our expertise at Kinder is not going to be the lived expertise and the earned expertise that you all have, that you all can share, right? That's this diversity and expertise. From that work together, we would hope to arrive at spaces where we're co-designing recommendations and policy briefs. And then additionally, coming together in the form of thought partnership. What are the ways in which we can be working together to just, make sure that we're sharing ideas amongst ourselves with one another. And again, the premise of this being that in working together, in collaborating, we are not competing, and there's just enough for us to do here that we can drive towards success together as opposed to racing side by side. So with that in mind, thank you, Heidi. We have put together another survey. So I realize Heidi just shared out his survey results. You're like, another survey? Yes, another survey. Leave it to a research center to fire up another survey. But this survey is a brief 5-minute survey. We are hoping to gain some insights from you all about how you all view and use and your comfort with data and research, and also wanting to provide opportunities for people to express interest in getting involved. If you would like to just sort of be on the sidelines, cool, great. That's totally understandable. If you're listening to this and going, oh, thank goodness, here we go, let's do this, let's get you involved. And so we've got a very short survey. It's online. It's available through Qualtrics. There's a hyperlink here in the slides. And then, oh, wonderful. Melissa, you were reading my mind. And the link has just showed up in the chat feature as well. If you could take a handful of minutes, get us some feedback on that. This will really help us to learn more about the organizations here, what you all are thinking about as it relates to this intersection of housing and health. And also importantly, what expertise we have the opportunity to connect with here. And so thank you so much for the opportunity to share out. I think I'm at time. I apologize. I don't think I left a Q&A, but Heidi, thank you so much for the opportunity to share out here this morning.
Thank you very much, Dan, and thank you also, Alan. We're excited about this collaboration and this opportunity to give those of you who indicated you're working in this space to come together and really rally around housing and health. We're a very exciting example of how these living conditions can come together. So thank you for your leadership to both of you. I'm going to move us along. And I'm going to pass it to Shrila to talk about updates from our task forces first.
Thanks, Heidi. So just to level set everybody, this was shared in the previous quarterly meeting, I believe, and many of you who are in the work groups have seen this. And of course, these slides will be shared after the quarterly meeting, but as we are evolving, as Dr. Borwinkle used the word nimble, which I think is very appropriate, we're looking to structure the collective where we can be nimble to the most immediate needs in our region in regards to social determinants of health. And just wanted to share this framework again that both Suzanne Jarvis and Michael Walsh and many others have contributed to in regards to how the work of the collective looks to initiate systems change. So just to orient everyone, the bar that you see in the middle is the work of largely falls under the work of the backbone co-leads in regards to facilitating community voice, aligning the framework and common metrics and communications around the work of the collective membership. On the left-hand side are the living conditions that many of you will see yourself and your organizations in. And the food security and whole person care are the two active living conditions. And as you just heard, we are activating the housing living condition as well. And on the right-hand side are the task forces, which are the actively sort of action items that we are working on at this point. And the two task forces that you see in the dark gray boxes are around the community information exchange that is being led by the data sharing ecosystem work group, and then the community health worker effort that is also being activated, which we'll talk about in just a minute. Next slide. So if we think about care coordination, there's largely three pillars. I mean, we can all talk in a lot of detail about what care coordination means and how it is activated, but there's the human capacity that you see right in the middle around care coordination that is anchored by the technology capacity to the left and then driven by community voice to the right. And these are the three primary action areas that the collective is facilitating at this point. And we want to provide detailed updates in each of these three areas today. The technology capacity largely being driven by the resource directory and the referral network infrastructure to facilitate care coordination for social determinants of health. The human capacity largely being activated through the aligning the community health worker efforts in our region. And then the community voice that is, how do we actually build community? What are the principles, practices, and values that we want to align to build community voice that Sean and others are leading as part of their work group. Next slide. So many of you have participated in several of the ad hoc discussions that we've been having, which will very rapidly turn into more formal discussions around community health worker capacity in our region. There's a lot of efforts that all of our organizations have been engaged in actively. Many organizations such as University of Houston, Texas Southern, and even UT Health are training centers for CHWs in our region which is all very exciting, but that also leads to an interesting challenge that we have, which is sustainability of community health workers as a workforce and aligning and coordinating community health worker efforts in our region. So that has been the work that we have informally initiated since last November, and with funding from the Houston Health Department through CDC, we will be moving it into a more formal capacity to really build out and coordinate and align the CHW efforts in our region. So more to come on that in terms of next steps. We are initiating a landscape scan of the CHW systems level efforts that are happening. And we will have, you'll all receive an invitation to a regional strategy session that we will be hosting in fall 2022 to learn about what are the different efforts that are happening and how can we coordinate, what are the capacities that we need to build out to sustain CHWs as a workforce, to build workforce capacity for CHWs, and also organizational capacity to support CHW work in our region. And then you're invited to join the CHW network group on Mighty Networks as well. Next slide. So in terms of the technology capacity of the care coordination efforts, we have two large agendas that we want to share with y'all today. One is the governance development, and Aja is going to give us an update in regards to building out the governance for both the resource directory exchange infrastructure and the referral network infrastructure. We have a charter that is complete and has been sent out, and we've been receiving feedback and are in the process of finalizing the charter and a playbook in regards to the governance for both of these pieces. And Galal Mahanta from PCIC will give us an update on the resource directory exchange proof of concept that they have been working on, which will come to a full fruition in the next couple of months. And then we will give a brief update in regards to some of the other work that is happening with the referral, activating the referral network infrastructure. We've made some really good strides and are formulating a very curated demonstration project that extends the health information exchange into the community and social service space. Next slide. I think with that, I'm handing it off to Aja, our team Autumn. If you're on, please share with the group the developments in regards to the governance structure.
Great, thank you, Srila. I apologize for the background noise. I'm in a hotel lobby here. So yeah, I'm just going to give you a quick update on where we are with the development of the governance structure for the CIE. Over the past 6 to 9 months, you guys have seen different iterations of what I'm going to show you today. This is kind of where we have landed after receiving feedback from various stakeholders. So before I dive into what that structure looks like, I wanted to talk very briefly about the difference between the CIE charter, which is the document that you all will have an opportunity to weigh in on in the next month or so, and a data sharing agreement. So the CIE charter is, we like to think about it as the rules of engagement for how the organizations that are participating on the community information exchange and any associated data collaboration initiatives, how they'll interact, how they'll make decisions. It's not a legally binding document. It is just simply an agreement between partners on how we're going to work together to achieve the mission of the CIE and the Health Equity Collective. And then, of course, you all, I'm sure, are aware of data sharing agreements. Those are those legal documents that are specific to a particular data collaboration initiative. So whenever organizations agree to share data, then they would enter into those legally binding data sharing agreements that are very specific to the data that will be shared. The charter is a very general document that just simply outlines how we're going to work together. So with that, we can go to the next slide. So this is the governance structure that we have landed on. You guys have seen different versions of this over the past, year or so. We have worked diligently, listened to stakeholders, tried to streamline as much as possible, and this is where we have landed. So we have the CIE Governing Board, which will be made up of HEC Steering Committee members, care coordination leaders, and then other community representatives. And this will be kind of the leading or oversight structure for the various data collaboration initiatives that will take place under the CIE. So right now, those collaboration initiatives consist of the Resource Directory Exchange, which Kawal will talk about in just a few minutes, and then the Referral Network, which is just kind of in the beginning phases of planning. And then there is room built into the charter for any future data collaboration initiatives that might come under the purview of the CIE. You'll see in that pink box to the right, the information quality panel. This is an advisory function that we devised to just help inform the governing board and those data collaboration initiatives whenever questions about information quality arise that perhaps there aren't existing experts on those bodies that have the answers. So it's a support structure built into the system. And then we also have, we're kind of thinking about this as a bench of technical advisors. These could be any folks who have the expertise to provide technical support or really technical advice to the governing board or to those data collaboration initiatives in an ad hoc manner. So they're a support function, and we'll talk about, I think on the next slide, which of these groups we're expecting to sign this charter document. So Heidi, if you want to go to the next slide. So those boxes outlined in yellow are the ones that we, the bodies that we intend to sign the charter document. So if you are actively participating as a member on the governing board, then we will ask that your organization sign the charter. If you are participating on the Resource Directory Exchange Design Committee, for example, then you would sign the charter, just agreeing that as part of this work, we're gonna act in these ways towards these specific ends. And then in the future, any additional initiatives that come under the CIE, the members of those design committees would sign the charter. And we have built in to the charter opportunity for review and revision of the document over time. Additionally, the information quality panel, since that's a standing committee or a standing function, we would ask those members to sign the charter as well. You can go to the next slide. Okay, so this is just a quick update on what we've done so far and where we are, what you can expect. So we have gone through many iterations of this charter and the structure that I just laid out for you. We've had lots of key stakeholder reviews, including the data sharing ecosystem work group. We are just kind of wrapping up collecting their feedback on the charter currently. In the next couple of weeks, we will send the charter document out in its latest, greatest form. We will revise it according to the feedback we got from the data sharing ecosystem work group. We'll send it out for you all to be able to provide your feedback. So this, you can think about it as an open comment period. You'll have the ability to go in, review the document, even those of you who may not be initially signing that document, signing the charter, because you're not participating directly on one of those bodies that I just described, you'll still have an opportunity to weigh in on its content. We will make revisions according to the feedback we receive. And then we plan for those organizations that are going to be participating on the governing board and the Resource Directory Design Committee and the Referral Network Design Committee to sign the charter starting around August. It'll kind of be a rolling process for signatures because the Referral Network Design Committee hasn't been formed yet. So folks will just kind of sign that as they come on board. In the meantime, we know that the HEC, that the membership, that you all are committed to this work. And so we have put together a letter of commitment that I believe maybe Heidi or Shrila will share out. And for those of you who just want to show your support of this work and look forward to in the future, possibly participating in a data collaboration initiative or on the governing body, we have a letter of commitment for you all to sign, and that will be shared out as well in the coming months. Next slide. I think that's actually it. Yeah.
Thank you, Autumn.
Thanks.
we're excited about the progress there and excited to provide the opportunity to the full membership for input in this really important process of guiding how we work together. I'm going to pass it on to Kalal Mahata with PCIC, who's co-leading the.
I have a question.
Yes.
Wait, Miss, I think someone's, Miss, I think someone's going to your screen.
Please mute yourself.
Sorry.
No worries.
Is your screen okay, Mrs. McPherson?
No, it's not. Hold on. I seem to have lost control of my screen.
Do you want me to share the slides, Heidi?
I think I've got it back. Let me restart. Do you have the slides up? Because
Yeah.
go ahead.
Okay, let me move it up to where. We're at slide 51, right?
Yes, thank you.
Okay. Let me. Hold on. Give me 1 second. Okay.
Okay. Are you ready to move along?
Yes.
You
yes.
might Heidi at your end or someone else's co-host, just make sure the list of invitees or individuals on the call
yes.
that look suspicious. Okay, I'll buzz through these. We're very much in the technical development phase of our work. And so I have a few slides just to go over what the progress has been, and I'll keep it fairly high level. Just a quick introduction on the technology framework. We brought together 3 different vendors to work together and to combine resource data across these 3 agencies. In addition to that, we've also brought in data from 211. A lot of our work in the last couple of months has been focused on integrating that new data we brought in from 211, which were exports from the iCarol system. Can we go to the next slide, Shula?
Heidi, are you asking me to remote control my screen?
No, I'm not.
I don't know, it's saying.
Decline it.
Okay, I've declined it 3 times. Okay. We may have someone who's hacked into this Zoom call.
And I'm happy to screen share also if you're having issues at your end.
This was the next slide. Do you want me to move forward?
Yeah, next slide, please. Okay, so just at a high level, the piece we're building it is the API design, and a lot of that is behind the scenes. And so I wanted to just present what this looks like when a service provider further down the road is accessing the system. The idea is to provide resource directory data in a way that it enables more accurate and expanded resources across our community from different solutions or different resource directories that are hosting this information. Other other functions as the work expands would be to improve things like capacity modeling, to know which agencies have capacity to handle cases or handle referrals, as well as eligibility modeling to really understand, are we sending the right resource or the right individual to the right resource? And so while a lot of the initial work now is laying the foundation, this is the view in which a service provider or a community health worker will access the system to get this much more robust data from the resource directory exchange. Next slide, please. And so I have a couple of bullets here, which if we can just click through these, Sheila. The work that has gone in is really to look at three key areas. One is when you have production systems like PCIC systems and Wellmities and combined DUMs already in place, what does it take to do changes in place while these production systems are running to make it compliant to standards like HSDS and AIRS, which is what we're using to bring the data together. So the focus has been really on what is that step-by-step approach so that it does not impact existing work that each of these agencies are currently doing in referrals, as well as community care coordination. Next slide, please. And so a lot of the work is around building it in a phased approach. We did some of the key findings in our work has been to really look at understanding different data architectures that are involved in such a design. There even among—
That's me. That's me. Accept. Please accept.
I am going to recommend, we've clearly been hacked. I'm going to recommend that we terminate. We have the listserv for you all, and I can send out a new link where we can finish the call. Does that sound reasonable?
Very much so, yeah.
Yeah.
Because the individual on the call is impersonating several of us in the meeting. So I will send out a new link just to this listserv directly, and we will continue the meeting at that point. Thank you.